Good morning. As I said, my name is Sharon Merriman Nye. I am here at the Center for Drug and Health Studies at the University of Delaware. We are the facilitators of the State Epidemiological Outcomes Work Group. That's a mouthful. We'll refer to that as the SEOW throughout the day. Today, we're really featuring a lot of information about the SEOW and the services that it can provide. I'm going to go ahead and ask that Rachel advance the slide. So I want to thank the Division of Substance Abuse and Mental Health for their ongoing support of the SEOW. This is a webinar that is being recorded. We're recording now. We will be making the recording available on the SEOW YouTube YouTube channel. We'll also make the slides available for folks who want to download them and review them later. They can be shared. Both that and the link for the recording can be shared. If you'll go ahead to the next slide, I want to introduce our other presenters today. We'll have Dr. Dana Holtz joining us and Dr. Rachel Riding. All of us are members of the Center for Drug and Health Studies at the University of Delaware. We have been working with the SEOW project for over 10 years now. If you'll advance to the next slide, I'll tell you a little bit more about it. Our objectives today are to introduce you to the services and the data products available through the Delaware State Epidemiological Outcomes Work Group. And these are available to support behavioral health initiatives throughout the state. The second thing we want to be able to accomplish today is to help you to identify Delaware-specific and national data sources that can also help in your program planning, implementation, and evaluation. Next slide. So what is the Delaware State Epidemiological Outcomes Work Group? If you'll go to the next slide, Dana, excuse me, Rachel. So I mentioned that the SEOW is a project that we've managed for over 10 years at the center. These were initially created as part of the federal government's Substance Abuse and Mental Health Services Administration's Strategic Prevention Framework grants. And there are 4 goals to the SEOW. We are responsible for identifying, analyzing, and sharing data to support behavioral health efforts. We create data products to help to communicate this information. We work to train communities in understanding and using data, and that is the crux of what we're doing today. And then through this process, we build state and local level monitoring systems to help collect data on substance use and other behavioral health issues, and to help inform the kinds of products that we create and to help to disseminate this information. I do want to emphasize that we do not operate in a vacuum with the SEOW. Currently, we have approximately 120 representatives from more than 50 organizations throughout the state, nonprofit organizations, state agencies, community groups, advocacy groups. These folks have an interest in identifying and using data to support their programming efforts, their evaluation efforts. We turn to them and we ask for their input to help us decide on the kinds of issues we should be looking at, the kinds of data products that we should be creating, and how to best share this information with the stakeholders. So this is a very iterative process. Next slide, Dana. And we do these things in 2 ways. We create proactively a number of data resources that we share out, and then we provide a number of technical assistance services that we are able to do kind of on demand, the ability that our capacity will sustain. So if we go back to that slide, one more slide back, Rachel. The products that we create, there's a variety of them and they serve different purposes. The most comprehensive is the annual Epi report that we develop. We're currently working on the 2021 version. I'm not going to go into detail about that right now because Rachel is going to highlight that in her portion of the presentation. But I did just want to mention that this, as I said, is the most comprehensive. It addresses multiple areas of substance use, and it also identifies issues that are like hot topics and populations that bear disproportionate risk for certain kinds of issues. And from the Epi report, we also develop a number of supplemental materials that we push out there for your use. We'll create infographics based on this. We make the slides of the data that's presented in the report available. These are resources that you can use for your outreach, for your presentations, your publications, etc. Everything that we're creating in terms of a data report or in terms of a data product is something that we want to put in your hands to be able to use in the best way that you can for your particular needs. So we just ask that if you use one of our data products, you simply cite us for that. In addition to the Epi report and those infographics that I discussed, we have a number of other kinds of materials that we produce. If we find that an issue is particularly thorny and we want to do a deeper dive, we may create a gap report or a policy brief about it. We've already talked about infographics, but another specific type of infographic that we've developed are some Venn diagrams that highlight shared risk and protective factors, which are extremely important to leveraging prevention efforts. I've already mentioned we're recording today and that the recording will be available and the presentation of today's meeting will be available in slide form on our website. Dana, if you'll go to Rachel, if you go to the next slide, I will just highlight some of the services that we can provide. So in addition to the SEOW events that we sponsor, we also respond to requests from stakeholders to conduct presentations in the community. So for example, in the past year, we've done a number of presentations at the request of the Sussex County Health Coalition. Whenever we go out and do these presentations, we figure if it's important enough for one stakeholding group, we may find that this is important enough for others to hear about. So we try to make all of our presentations available online. In addition, folks will come to us and they might want to discuss, they may want to say, we're working on a grant application or we're working on developing a needs assessment. So what are the data points that we might want to incorporate? So we go back and forth with folks and help them to select data indicators, measures, provide some feedback on things like logic models and evaluation plans. We basically want to respond to the needs of our groups that are doing the work of prevention and treatment in Delaware. So in addition to those proactive data products that we provide and push out, we are trying to respond to the needs as they emerge in terms of technical assistance to stakeholders in the group. Now, on occasion, folks will come to us with a particular data question where we may be able to go in and do some customized analysis on a data set to answer a particular question that they have. So to the extent that we're able to do that, we certainly make that service available. If you have any questions for us at any time, we encourage you to reach out. If you'll go to the next slide, Rachel. We know that everyone on this call has a different need for data and probably a different level of comfort with which they work with data. So this is just kind of for fun. We wanted to just show you that, some of us think of data as like a crazy fun house and others think of it as sort of a rustic, solid, foundational part of what we do. Whatever you're doing, we know that there's room to become more comfortable and more familiar with using data to support your efforts. So if we'll go to the next slide. It's now your turn. I'm hopefully going to launch this poll correctly. I'm going to ask you to select how you use data in your work. So hopefully, I see this here. Can you all see the poll? Rachel, can you see the poll up on this?
Yes.
Okay, great.
Yes, it's active.
We'll
Like
give
folks
it
are taking
a
it.
few more seconds. You can check any that apply to your work. So, you know, we've got needs assessments, grant applications, program planning, documenting your success and challenges, evaluation, and perhaps other reasons that we haven't noted. So what I'm seeing right now is that the most frequently cited need is for evaluation purposes, which is not at all surprising. But we're also seeing a lot of folks, you know, are looking at it to document success and challenges. You're using it for program planning, for needs assessment. Many of you are using it for grant applications, and that makes us very happy because we definitely want this information out there to leverage bringing resources into the state. Okay, I'm going to give it another few seconds and then end the poll. Okay, so by and large, evaluation needs are top, followed by grant applications. That's very helpful for us to know. Okay. So if we'll go on to the next slide. As I mentioned, everything that we produce, we post on the SEOW website at the Center for Drug and Health Studies. And this is our landing page. I just want to point out that if you look at the left-hand margin, you know, we do have the landing page, which is what is SEOW, and then we have the Epi Report page that breaks out some of these other materials. We have the special tab for presentations and special reports. We make the individual chapters of the Epi available, so it's a little bit easier to digest. Rachel's going to talk a little bit more about our Delaware heat maps, which are one of our very most popular products. That we find that this is something that communicates visually very quickly issues, and as a matter of fact, the SEOW is going to be it has an article coming up in the upcoming Delaware Journal of Public Health talking about this as a very important tool for public health communication of data. So we have a number of different things on that left-hand margin, but across the top, I do want to point out two tabs that I think are also important for you to take note of. One is the resources tab, which includes subpages on data resources. So we're going to highlight in the next couple of portions of today's session, data resources that are specific to Delaware, as well as national data sources along different topic areas. And these can also be found along with other resources on the resources tab of the center's SEOW pages. The other tab I'd like to point out is that last tab, News from the Field. We frequently highlight new reports and information that may not be, they're not portals, they're not necessarily standing or recurring data collection sources, but they might be report outs on particular issues. And we post information on health, substance use, violence, and criminal justice. So I would encourage everyone to get in the habit of frequently checking into these resources and taking a look at what's available. Next slide. Now I'm going to turn it over to Rachel to do a deeper dive into the Epi Report and some of the more Delaware specific data sources that we'll be discussing today. Thank you, Rachel.
Thanks, Sharon. Yeah, so I'm going to spend just a little bit of time talking more about all of the different data sources that go into the Epi Report. And then I'm going to demo a little bit on our own website with where you can find the Epi Report and some of these resources, and you know, where you can find the heat maps and how to actually use those heat maps. But as Sharon mentioned, you know, the Epi Report, the annual state epidemiological profile, which we all refer to lovingly as the Epi, is a really comprehensive report we put together every year, compiling data from dozens of different sources, both national sources and Delaware sources, to really give this profile of behavioral health in Delaware. What are some of the main substance use concerns, as well as what are some special populations that we need to be considering when thinking about mental health and behavioral health and substance use. And we've listed some of them here that we use. we have some school surveys, like the Delaware School Survey, which is an annual survey administered to 5th, 8th, and 11th grade students. The Youth Risk Behavior Survey, which is every other year to middle and high school students, as well as the Youth Tobacco Survey, which is focused more specifically on tobacco and e-cigarettes and vaping. But we also use a lot of national sources that we'll talk a little bit more in detail a few slides down, such as the National Youth Risk Behavior Survey or the National Survey on Children's Health, the National Survey on Drug Use and Health. And with all of these different data sources with the Epi Report, we track down all the data from all these sources and put it together into one report. So it's easier for other data users to maybe find, what is all of the data that we have on people in Delaware pertaining to alcohol use without you having to go to all of these different data sources to find all those comparison indicators. So it's a really great product for that reason. And I'm going to stop sharing the slideshow for a moment and share our webpage with you. So I can show you a little bit more about where the Epi Report is and what kind of things you can find with it, as well as, here we go, as well as some of these heat maps and where we can find those, which Sharon mentioned. So if we go to, can everybody see my screen now? Okay. So if we go to the cdhs.udel.edu webpage, we've got this SEOW tab, which Sharon demonstrated in a screenshot. And one of the drop downs is our epidemiological reports and products, which is where you can find the most recent Epi report, as well as a lot of infographics that we put together with data from the Epi report or with some of this other data that we have access to. So for example, June is Pride Month, and we recently put together an infographic on the importance of LGBTQ affirming spaces for youth. So you can find that infographic here. We have infographics on driving and substance use, infographics on individual substances of interest, things that are drawn from the Epi report. And we can also find, let's see, individual chapters of the Epi report. It's a very big document. You might not want to download a 300-page report, or if you're just interested in marijuana, for example, you can just download that individual chapter and look at those figures. And on this left tab here, we can also find the Delaware heat maps. These are interactive maps of substance use by zip code across the state of Delaware. So they're really useful tools. So you can select 8th grade or 11th grade. I'm going to demonstrate the 11th grade maps just very quickly. Sometimes they take just a moment to load on the page. But so this top map here is past month cigarette use among 11th graders in Delaware who are surveyed by the DSS. And when you see these different tabs across the top here, we combine 2 years of survey data for each map. This creates slightly larger sample sizes and helps kind of protect the confidentiality of the schools that are participating, the students and where they live, since we are mapping these at a fairly granular level at the zip code level. And for that reason too, some zip codes, we combine multiple zip codes in reporting. If there's maybe too few students residing in one zip code to report, or to protect the confidentiality of a particular school, we might combine multiple zip codes. But with these, you can see the past month's rate of cigarette use for the state of Delaware, all 11th graders, is around 3%. And we have that figure for the state rate in this legend on the side. And then you can see with these different colors are shaded based on the prevalence of past month cigarette use within each zip code. So there are zip codes where the prevalence is higher than the state average, which might be areas where we would want to focus tobacco cessation efforts. And then if you click on a particular zip code, you can see which zip code or zip codes are represented there, as well as the sample size, so how many students were surveyed that reported living in that zip code, and then the specific rate of use. So this bottom zip code here, it's actually combined 19940 and 19956. So this is 2 zip codes together. There are 200 students that reported living in these zip codes that were surveyed. And 8% of those students reported using cigarettes in the past month, which is higher than the state average of 3%. And this map can also be zoomed in or out using these arrows. You can click on these different tabs if you want to look at previous years. Some questions, we go back all the way to 2015 or 2014 with the maps. Some questions such as vaping, which is a little bit newer. We haven't been collecting data on vaping for as long. So with these, we can only go back to 2016. And if you scroll down the left here, we go through all the different substances that we've made maps for. So there's alcohol, binge drinking, marijuana use, and we also have some prescription use maps if you go a little bit further down. And we're gonna get back to the presentation now. And one last thing that I'm going to talk about before I give everything back over to Dana to talk more about some of these Delaware specific data sources is a little bit more detail about some of the national data sources that do go into the Epi report and that can be accessed and can be really useful sources of information that provide state level data for Delaware often. Oh, excuse me. Okay. And we'll make all of these available, and these are all hyperlinks in our PowerPoint, so we'll make all these links available if anybody wants to access some of these on your own. The America's Health Rankings, the first one we have listed, is a really useful tool because it provides a lot of health indicators that include substance use and mental health, and it provides a snapshot where you can really easily compare states and national averages. So if you're wanting to look at, how does Delaware compare? This is a great tool to help make those comparisons easier. The Behavioral Risk Factor Surveillance System is a CDC survey of adults that provides state and national level data for a lot of health related topics. And they have a web analysis tool that's pretty user friendly where you can look at specific indicators and make your own crosstabs for the state of Delaware or any state that you're interested in. So you can look at things like alcohol use among adults and then look at how that breaks down by gender or by race and ethnicity or by education level, which is a really neat tool to be able to have. There's some national surveys that go into a lot of our data products in the Epi report, including Monitoring the Future and the National Survey on Drug Use and Health. Monitoring the Future is a annual survey of 8th, 10th, and 12th graders that asks a lot of questions regarding substance use. And these make great trends that are good for comparing, what's going on with Delaware youth with the national sample, as well as the National Youth Risk Behavior Survey. The National Survey on Drug Use and Health is a SAMHSA-funded initiative that surveys youth and adults ages 12 and up, again, on a lot of behavioral health indicators, and it's a very large sample, it's very comprehensive, so again, that helps. You can get data at the Delaware level or at the national level, so it's another useful tool for looking at prevalence estimates and then comparisons. We also have the National Survey of Children's Health, and there are a lot of indicators here that are available at the state level as well. And we include some of this data in our Epi report. Policymap is another really useful tool. It uses geographic information systems or GIS. So you can go to the webpage and look at a map of Delaware. And for a lot of indicators, you can get down to the census tract level if you're wanting to look at poverty or employment indicators or overlaying that with health data across the state. And you can create your own maps in a way that's really user-friendly. And there are a lot of publicly available mapping tools that you can do with this site, as well as a lot of institutions can access more content. But it's a great tool to kind of play around with if you're wanting to look at mapping some Delaware data. And census data, of course, is always a great source of population level information, and they they have a new data center. They used to use the American Fact Finder tool, and now they use the Census Data Center. And there's just so much data available, and a lot of it you can get it down to a more granular level. And then finally, the Substance Abuse and Mental Health Data Archive. This is a useful tool if you're a data user who's wanting to access the actual data or the data sets. This is the archive where you can find the actual NISDA data, the public use files, or some of the treatment data via TEDS and those kinds of things, and can be a really useful tool for a more advanced data user who maybe wants to access things and run them yourself. Okay. And at this point, I'm going to turn it over to Dana, and she's going to talk a little bit about Delaware data sources, and then she's going to demo a few tools with My Healthy Communities and with Kids Count in Delaware that are really great sources of information for Delaware specific data.
Thank you, Rachel. So I'm just going to switch over to my browser and start here. So since most of you are likely interested in Delaware data in particular, I'm going to provide a live walk through some of these more. The first one is a Delaware Division of Public Health statistics page. Few resources here you might find interesting. The BRFIS was mentioned previously. And many Delaware indicators are on the national BRFIS site, but if you wanted to look at things like demographics or age or just more breakdown, you can go into their BRFIS page and see tables, county level data, which is not available on the national site, as well as past data. So that's another access tool, access to the BRFIS. The DPH page also has a link to Pram's Pregnancy Risk Assessment Monitoring System. And this has some questions about, it surveys women prior to and after birth and on questions around alcohol use or tobacco use before pregnancy, violence in the home, mental well-being, and so on. The Youth Tobacco Survey is also accessible here through this website. This is a survey that's administered in Delaware Public Schools and middle and high schools in Delaware. Our center actually administers the survey. If you wanted data for the Youth Tobacco Survey or any of these other pieces, you can follow the DPH's data information and request process, which is up here at the top of the page. Another excellent resource managed by the Delaware Department of Health and Social Services is My Healthy Communities. You're likely very familiar with this website if you've been following the coronavirus data very closely, because they have an excellent coronavirus data dashboard. In this case, we're going to look at the population health dashboard, which is right here. And you can start, the landing page here starts with the community characteristics of population of Delaware, race, and demographics. But we are going to go look more closely on the left side over here at the mental health and substance use tab, which is on the left side. In this case, well, first I want to show you that this is a new feature that I just actually noticed the other day looking at this web page. They have a really interesting story map that's on this website now. It's based off the DPH's opioid mortality and fatality risk report, drug overdose mortality surveillance report. I'm just going to pull this up really fast. It's actually really very interesting data story map here. So this might be something you would all be interested in looking at some point. They have trend maps here, different demographics, and it's just very well done. So this is a new feature here. But going back to their main page, I'm going to pull up, just as an example, the youth use of prescription pain meds without prescription. And you can see available is a trend line. There's different levels, different indicators. There's a hotspot map. Trend lines are available. And you can see this at different levels. So if you go up to this box right here, you can look at different levels. Now you can look at data on this website for different zip codes, census tracts, Senate districts, House districts, et cetera. But generally for data, a lot of it doesn't get down to those lower levels. So if you ask, for example, for a census tract, it'll pull up the next lowest area. So in this case, if you look at the trend line, what it pulled up was Kent County, because that census tract was in Kent County, but they didn't have the census tract data, so they pulled up Kent County. So that's a really neat tool as well, that you can select the lowest level of data analysis, and it'll pull up the most closely aligned available. Also at the bottom of the page, you can probe a little bit deeper. Just gonna, there's some different resources available. And you can get some resources here. They have the link to the Help Us Here Delaware website, which is a really comprehensive website. The Delaware Behavioral Health Consortium 3-year action plan, the YRBS, Healthy Homes prescription drop-off locations, and places to obtain naloxone. It also provides a little blurb about the data. So in this case, the data came from the Delaware School Survey, which is administered by our site. So I'm going to move on to another really great resource, which is Kids Count in Delaware. And I think Janice and Erin Lynch are both on this call right now, so I hope I do credit to their excellent work. One thing about Kids Count, they collect a tremendous amount of data, but they also provide really wonderful data analysis. And I've said before, I think Janice Barlow is one of my favorite presenters because she does such a comprehensive analysis of data and how it and contextualizes it and why it's important. So this is their local website. And this is out of the Center for Community Research and Service at University of Delaware. You can get access to their fact book here, which is down here, as well as there's some events that they have coming up. So I highly recommend them because they do a wonderful job. If you wanted to look at how Delaware compares on some of these measures of data around kids' health and kids' well-being, you can go to the National Data Center site. It's very easy to access. So just simply click on a Delaware map, and you can pull up data along the side here under topic area. It's waiting for it to load. So for example, a lot of the work we do is around health, safety, and risky behaviors would be in this category. So I'm going to click on this, and all the way down to the bottom, for example, under other safety and risky behaviors, there is, for example, teen mental health by risk factor. So I think this is really neat because you can look at the data in so many different ways, and I really appreciate this website for this reason. So you can download the raw data if you want it. You can look at the data as a table, and as you can see, this is the table. The S meaning there was not sufficient number suppressed because there was sufficient numbers to report. But you can also look at the data through a trend line or a bar. In addition, I really like the fact that they have this piece, so why this indicator matter, because it kind of contextualizes data and explains why it's important. So depending on the data that you're looking at, these different ways of looking at data might not be very helpful. For example, for this indicator, I didn't find the trend line to be very illustrative, but you could look at the bar graph, and you can immediately see that there are, for students who reported that they felt sad or hopeless in the last 2 or more weeks at a time, the last 12 months, if they had hurt themselves, you can easily see right away there's 3 populations that have disparate health risks, and that would be people who are reported being bullied in the past year, students with emotional disability, and bisexual youth. So, and then these blank spots are the suppressed data. So I think it's really useful that you can look at the data in different ways. You can also look on the left here, use this tool to look at like just a specific categories. So you could click on bullied in the past year and felt sad. And it'll show you that 55% of people who were bullied in the past year felt sad or hopeless in the last 12 months. So it's just a really comprehensive tool. It's very helpful, and I encourage you to use it. So that is really the live walkthrough of these different categories. I'm going to stop sharing, and then Rachel, if you could pull up the presentation, please. All right, so we've showed you a few potential data resources that are easily accessible. And now we thought we'd have a little fun and have a data scavenger hunt. So we're going to break you all up into different rooms, breakout rooms, and we're going to give you a data problem to solve. And we'll come back to discuss. Best of luck.
Thank you, Dana and Rachel. Those were great overviews. I do want to just emphasize that these are, we have shared a lot of information very, very quickly this morning. There are a lot of other resources that are available on our website. I also want to point out that on the call today, we have Dr. Tammy Anderson, who works with the DOMIT project. We have information on the SEO, on the CDHS website about the DOMIT project, which also monitors prescription drug use. And perhaps at the end, we'll have a couple of minutes to do some general discussion. But right now, we're going to go into a breakout room activity. And I always like to preface these things by saying, I am not your technological wizard, but I think I can get you all into breakout rooms. There are a number of rooms. We have a data scenario and a facilitator in each room that's going to share that particular data scenario. And based on what you've heard today, as well as other sorts of things that you might be familiar with, we're going to ask you to try to let us know where you would find the data to answer that particular question. I do want to say we'll come back. Let's break for the next 10 minutes and have a discussion. You can also share a little bit in that room about what it is that you're using data for and what kinds of resources you found to be particularly helpful. We'll come back and have a brief report out and wrap up, and then we will we'll close with some future thoughts. So I'm going to send everyone to the breakout rooms.